Good day and welcome to USD. This is Dr. Stuart Ingalls. For those of you that haven't met me yet, I serve as course director for the Anatomy 711 course and director of medical anatomy laboratories for the university. In the past, we have traditionally provided an overview of the anatomy course as well as an orientation to the anatomy laboratory during the Allied Health Orientation Week. This year, to free up some time and keep you from feeling too overloaded during that week, the course overview has been pre-recorded in this video podcast format, so you can watch it at your leisure in the weeks leading up to your matriculation. We will still have the laboratory orientation this year, as it involves visual demonstrations and hands-on components that require you to be on site, but the whole thing should go quicker than in years past. I'll also reassure those of you that are feeling nervous or apprehensive leading up to cadaver dissection that although you will be standing at the station with the body you will be dissecting during this laboratory orientation, the bodies themselves will remain covered and there will be no actual dissection during orientation. So you don't have to be concerned about any of that for the orientation itself. This video will provide you with a general overview of the anatomy course. It will introduce you to the instructors that you will see throughout the term, give you a breakdown of the evaluation components that will be used during the course, and we'll finish off with some general tips on how to succeed in anatomy, many of which can be applied to the rest of your graduate studies as well. First thing to point out is that the gross anatomy class is actually an amalgamation of two separate but integrated classes. First is what's called the IMC 501 course. This is the medical student class, which is better known as Medical Foundations 1. So in this case, anatomy is a smaller component of the large whole that also includes biochemistry and some clinically related material. Anatomy 711 is the anatomy-specific course that is being offered to the allied health fields, occupational therapy, physical therapy, and physician assistant. The important thing to realize is, though, that there are two separate classes with two separate course identifiers. All students attend the same lecture sessions, and all students participate in the same dissection class. In fact, when you're assigned to your dissection tables, you will find that in most cases, it will be one medical student, one OT, one PT, and one PA student, all collaborating together to complete the dissection. In a few cases, there will actually be two medical students at one table. This is just because of the larger class size for the MS1 class, but wherever possible, the tables are fully integrated through the four separate disciplines. This also means that while individuals will be attending the same lectures and the same laboratories, there will be different testing procedures. The medical students will be taking what we call the integrated multidisciplinary exam. What happens in this situation is that the medical students are presented with tests and examinations of variable question size, but in all of these cases, the questions will be pulled from all of the different disciplines. This includes anatomy, biochemistry primarily, but for any of the additional didactic or clinical sessions that the student has experienced within that week. So the anatomy itself is a smaller component of the entire Foundations 1 block in itself. We compare that to Anatomy 711. This is an anatomy-specific exam. This course is functionally separate from the additional classes that the Allied Health will be taking at this time, and therefore the tests and examinations will be 100% based on the material presented specifically in the Anatomy 711 exam. One thing that I would like to point out at this point in time is that while the medical students and the allied health students will be taking separate exams, there is no difference in the difficulty level for the written questions. In fact, a large proportion of the IMC 501 anatomy questions are incorporated into the Anatomy 711 examinations, and then additional questions are built in as well because it is an anatomy-specific exam. Each year we seem to have students that are of the mistaken impression that one group is given an easier time than the other. I would like to assure you from the start that that is not the case. and understanding of anatomy is incredibly important to all medical health professionals, and all medical health professionals are tested with the same rigor. To give you an idea of how the course will run, it's a 12-week course in regional anatomy involving cadaver dissection. If you've taken anatomy as an undergrad, you've probably taken what's called a systemic approach to anatomy, in which you will look at one system at a time, all the muscles of the body, all the bones of the body, the digestive system, the respiratory system, etc. With a regional approach, we actually look at the different body regions at a given time. So, for example, we will look at the upper limb, particularly the upper arm. We will look at all the bones, muscles, vessels, nerves within the upper arm, and then move on to a different region, the forearm, for example. Systemic approach is ideal for an undergraduate situation in that conceptually it's an easier way to first be introduced to anatomy. Regional anatomy is ideal for a graduate student level in that when you finish your programs and are practicing within the field, you will have patients that present with conditions related to a specific region of the body. As a healthcare provider, you need to be thinking of the region of the whole and all of the different structures found within that region. The class itself is broken down into 3 separate units. First, we have what's known as the axial and appendicular musculoskeletal systems. So we'll be looking at the back, the vertebral column, and the muscles which move the back. And then we will move into the upper limb with the bones and musculature, as well as circulation and nerve supply. And then we'll take the same approach in studying the lower limb. Second unit is head and neck anatomy. It may seem like a small region to have an entire unit dedicated to, which it is, but there's a lot of complex structures, and it does require almost the same allotment of time as we see in Unit 1 to be able to effectively cover all of this complex material. With Unit 3, we move into the body cavities and the viscera, so we'll be opening the thorax to look at the lungs and the heart, and then we'll be opening the abdomen to look at the digestive organs, and finishing off by opening the pelvis to look at the pelvic viscera. Different methods for information delivery. There's the traditional didactic lectures in which students come to a lecture hall and take note based on an instructor's presentation. That being said, the first unit is actually going to be taught using a flipped classroom design. If you're unfamiliar with the term flipped classroom or would just like to see how it is being implemented in this course, there is a YouTube link provided in your orientation letter and repeated at the end of this orientation, which will take you to a secondary video. It is strongly encouraged that you watch this video prior to the start of the course to give you a better idea of what to expect within those first 4 weeks. The big component of this class is dissection lab. As already stated, you will be divided into dissection teams of 4 individuals representing, whenever possible, the 4 different medical fields, and you will conduct a full body dissection based on the didactic lecture presented prior to lab. In addition to dissection lab, on certain days there will be small group activity sessions. These are typically dry osteology labs. We have bone boxes that have the various bones of the body. So as they are introduced, you will be expected to conduct a 1-hour osteology lab section with your lab partners in which you identify the relevant structures using the bone boxes provided. Additionally, at the end of certain topics, we'll be inviting clinicians in to speak more relevantly about how the anatomy is applied in the clinical field. This will typically involve a medical clinician, but wherever possible, that clinician is encouraged to bring occupational therapists, physical therapists, or physician's assistants that they work closely with to be able to give an interdisciplinary approach to how different conditions are treated. Finally, before exams, we will have specific review sessions in which we will cover relevant and particularly difficult material, as well as attempt to provide review questions to help focus your understanding. So the course is going to run 4 afternoons per week, Monday, Tuesday, Thursday, and Friday, from 1 o'clock to 4 o'clock in the afternoon. From 1 to 1:50, we will have either the didactic lectures or, in Unit 1, what will be called facilitated active learning sessions. At 2 o'clock, we move into dissection time. The way it works with this class is due to size constrictions. The class is divided into 2 separate dissection teams, Group A and Group B. On a given laboratory day, one group will begin inside of the lab doing dissection. The other group will begin by experiencing what's called consolidation time. This is just a fancy term for independent learning. You may review your notes from the previous day's work. You may read ahead to material covered in the next lecture. You may spend the time studying for additional courses. You may decide not to study at all, but rather take a break and socialize with friends, catch up on errands. This time is entirely at your discretion. At 3 o'clock, we will experience a transition in which the group that was in the lab dissecting will finish up and exit, and the group that was experiencing consolidation time will now come into the lab to dissect their halves of the body. At this point in time, the group that was initially in dissecting will experience their consolidation time, and once again, they will have the opportunity to do as they please during this period of time. A couple of notes to make here. First is that there will be times when we will have combined group labs in which both A and B will be in the lab at the exact same time. This is because it's either an incredibly long dissection that will require a lot of time intensity, or it could be related to a unilateral structure such as the heart, in which everyone only has one, so everyone needs to be present to observe and participate in the dissection. Another important note is that we alternate per days, so that on a given day, Group A will be the first into the lab and Group B will be experiencing their consolidation time. The following day, Group B will start in the lab and Group A will experience consolidation time to try and keep it as even as possible for all students. Another note here is that we previously mentioned these osteology dry lab sessions as well as the clinical correlation sessions. These are scheduled during consolidation time, so there will be occasions where rather than being given consolidation time, you'll be expected to conduct a dry bone lab or participate in the clinical review sessions. The majority of time, however, will be dedicated to consolidation time. Between 4 and 5 p.m. will be open laboratory time. This is completely optional, in which the instructors will remain behind after completion of the scheduled dissection, but it does allow individuals from both Group A and Group B to either continue or return in the lab to be able to complete a dissection or review the structures that were identified from that day. Textbook for the class, if you haven't already picked one up, we typically go with Keith Moore's Clinically Oriented Anatomy. It's currently into its 7th edition, but a question that I get quite frequently is if I was able to pick up an older division secondhand or at a good price, will that suffice? The answer is yes, really. If we typically say it's not a good idea to go more than one edition removed, which would be the 6th edition in this case, but the information really hasn't changed from year to year as far as gross anatomy goes. It's a pretty consistent subject, so if you were to go several editions back, it would probably still be perfectly fine. You just have to accept that any page references that are given are not going to be quite as accurate in your particular edition. But as graduate students, I'm sure you'll be able to figure out which page ranges apply to your particular edition. There's other textbooks that can be used as substitutes for this class. One example is Gray's Anatomy for Students by Drake. This is pretty fantastic textbook and one that I've gotten a lot of use out of myself. I just find that the images from Moore's are a little bit cleaner and crisper. They've also been used in this specific class for years upon end, and so we're a little bit reluctant to switch to a different textbook. But If you have a chance to look at both of them and compare them side to side, absolutely nothing wrong with using Gray's Anatomy for students. If you really like a challenge for yourself, you can actually pick up the full Gray's Anatomy. A bit of a warning, though, that this is over 1,000 pages, and it is very in-depth. This is the gold standard by which scholarly anatomists learn. So from a medical or allied health student's perspective, it goes a little more in depth than is really necessary for the scope of a clinical class. Yet, if you have an extensive background in anatomy and are up for a challenge, this might be something to look at, and it always looks impressive on your bookshelf as a reference text. The bottom line is, whichever textbook you choose, be very careful. These are really the only three that I would suggest for this type of class. You've probably come across a variety of different textbooks from your undergrad. Some of the more common ones are Tortora, McKinley, Marieb, and Mallet. Those are wonderful textbooks from an undergraduate perspective, but they will lack the necessary detail in order to be successful in this class. So I would strongly recommend that you look primarily into Moore's clinical anatomy, but if you really don't like the feel of it, Gray's would be a pretty good substitute. Those are the the only two books that I would really recommend for this particular class. Time to meet the faculty a little bit. Start off with myself, Dr. Stuart Ingles. So that's me. I'm originally from Canada, in an area just outside of Toronto. Did my bachelor's degree at McMaster University in Ontario, Canada, with a bachelor's in kinesiology. Went on to the University of Western Ontario to do a Master of Science, then moved to Ohio to do my PhD at Ohio University. I currently stand as an assistant professor of basic biomedical sciences, and as already stated, I am the course director for the Anatomy 711 course and director of medical anatomy laboratories at the University of South Dakota. I will be the principal lecturer for the first unit. The lectures are pre-recorded, and I will be more of a facilitator for actual class interaction time. And I will be a laboratory instructor throughout the class for all three units, 1, 2, and 3. Dr. Moorcraft did his graduate work at the University of Iowa. Very big Buckeyes fan, if you're interested. He currently is a full professor of basic biomedical sciences, very heavily involved in research, primarily involved in regeneration following neural injury. And he is the principal lecturer for Unit 2, the head and neck portion of the course. As a large portion of his time is taken up with his research, he will only actually be with us for Unit 2 of the class. He will be the lecturer, and in laboratory for this portion, we will not see him involved in Unit 1 or Unit 3, as he is going to be occupied with his research at this point in time. Dr. Das comes to us from India originally and has spent a large number of years teaching at medical schools, primarily within the Caribbean, but also China and other areas. Very much has traveled a great deal of the world, and a fascinating individual to talk about those experiences. Dr. Das is heavily involved in the portions of anatomy, embryology, and histology throughout the medical school curricula. For the purpose of this class, he will be the lecturer for Unit 3, which is a specialty looking at body cavities and viscera. In addition, he will also be a laboratory instructor on hand for all three units of the class. So you will get to know him very well during the laboratory sessions, and then you will have him as a lecturer during the third unit. If you did your undergrad at the University of South Dakota, you're probably familiar with Professor Scott Drucker. He attained his Master of Science from Nebraska, big Cornhuskers fan, and has been spending the last decade or so as an instructor in the basic biomedical sciences, primarily responsible for teaching the Physiology 220 series at the undergraduate level. We're fortunate enough to have him as a laboratory instructor for all three units. He might be pulled out from time to time because of his undergraduate responsibilities, but will be there as an additional resource to identify structures within the lab itself. So although he's not a lecturer for this course, you will see him quite frequently throughout the class. Finally, we have Professor Kelsey Stevens, a recent MSc graduate of the University of South Dakota, and actually my previous graduate student. I served as her advisor for her Master of Science degree. She's currently serving as an instructor in the health sciences. She does the lab component of the Physiology 220 series with Professor Drucker. Because of her responsibilities to undergrad, she will really only be with us for Unit 1, which takes place prior to the start of the undergraduate fall session, but will be an additional set of hands and additional resource during Unit 1, which, as you're starting to get yourselves initially oriented to the dissection, is the time that you need the most hands-on support. Time to start talking about methods of course evaluation. One thing that's going to be consistent between IMC 501 and Anatomy 711 classes are your daily quizzes. At the beginning of each class, students will be presented with a total of 5 multiple choice questions. These will happen promptly at 1 p.m. on the nose, and it's each student's responsibility to make sure that they are there in a timely fashion to take these quizzes. In Unit 1, they're going to be based on pre-reading or previewing material that is offered. This is along the lines of the tradition for a flipped classroom approach. As we approach Unit 2, which is taught in a more of a traditional didactic session, we'll switch over so that the quizzes will be based on material from the previous class. There'll be a total of 31 quizzes, one for the beginning of each class, excluding the first class, obviously. But only the top 20 quizzes are actually going to count towards a student's final grade. So what this means, if you think about it, is that your 11 lowest scores are just going to be pitched. A few reasons for this. This is supposed to be a low-pressure situation, so that you realize one poor mark is not going to negatively affect you too severely. It also means that if you are consistently scoring very low in the area of 1 or 2 out of 5 in the first week or two of class, it gives you a chance to try and figure out how you can better approach the material. It gives you a chance to talk to myself and others and figure out strategies to be able to correct it. And hopefully by the time we're 5 or 6 quizzes in, you'll be more consistently receiving 4s and 5s and won't be as concerned about the lower marks. The other reason that we only count 31 is that these quizzes are taken using clicker technology. Each of you will be issued a clicker at the beginning of the term. It is your responsibility to remember it for each class and to make sure that your clicker is in proper working order. Occasionally issues come up. It is technology. Things do go wrong, and the clickers will not be able to record the scores effectively some days. So once again, the fact that your 11 lowest scores are being thrown out, if you have a day where your clicker is not working properly, then that is not likely to negatively affect you too drastically. It is each student's responsibility, however, to take care of their clickers, and if they do detect a problem in its functionality, to get it resolved with the tech department as soon as possible. Also note that the clickers will be used to monitor class attendance. Occasionally, from time to time, the chairs of the different varying programs will ask me how certain students are doing within the class, and one of the things that I'll be able to do is go back through the clicker spreadsheet, and if a student was not in attendance, not only will it have a score of 0, but it'll also show that there were 0 attempts made on a particular day, so I'll be able to report whether they're showing class on time and in a consistent fashion. The majority of points for the class will come from the theory exams. There will be a total of 3 midterm examinations, which will include 60 multiple choice questions on the content from that particular unit of study. In addition, there will be one final exam incorporating 100 multiple choice questions that will be cumulative over the 3 units from the term. The remainder of points for the course will come from the unit practical laboratory examinations. There will be a total of 3 of these, which will coincide with the end of each unit and will be conducted the day after the midterm theory examinations, the multiple choice examinations we just discussed. Because of restrictions with room size and the number of stations that we will have, we will actually be dividing the entire class into 3 separate sessions for taking the exam. Students will be randomly allocated into A, B, or C group, which will take the exams first, second, or third. And for the remaining examinations, the start order will vary from one test to the next. So if you were in the first group for one of the tests, you will be in the second group for the next test and the third for the other test. The way the exam works, it's a 60-station bell ringer examination. You will have a total of 1 minute per station. Important to realize that you are not allowed to backtrack through the stations. Once you are finished at a station, you need to move on to the next station, and you are not allowed to revisit. It's typically a straight identification of structures. Sometimes we will pin a muscle and ask you for the innervation of that muscle. But for the most part, if there's no additional structures, you just need to provide the identification of it. Important to realize that each one of these practical laboratory examinations only includes material from the current unit. So as we're doing head and neck, only head and neck structures will be pinned. There will be nothing from the musculoskeletal unit, for example. The other important thing to realize is that there is no cumulative practical exam at the end of the class. The third practical will coincide with the Unit 3 exam, but the following week, when you write the final theory exam, it will not have a practical component afterwards. That being said, we will probably take images that have been used in class and ask you to identify structures during the final multiple choice theory exam, similar to what would be seen in a practical exam situation, but you will not actually need to come into the lab for a cumulative final exam in the laboratory itself. Here you can see the overall point distribution for the course, that everything is pretty much weighted relatively equally except for the final exam, and that the total number of points available for the course is 520. This information will also be provided within the course syllabus that you'll be receiving during orientation week, and the course syllabus itself will be posted to the D2L website once you have been granted access. The overall grade distribution is as such. Anyone receiving a 90.0 to 100% will receive an A in the class, 80 to an 89.9 a B, and etc. so forth for C, D, and finally F. A couple of important notes to make at this point in time related to course evaluations. The first is that once a grade is released and the student has had an opportunity to review their exams and compare their answers to an answer key, if the student disagrees with the way specific questions were graded, they have 24 hours to contest that grade before the mark is finalized. What this means is, if you get your midterm 1 theory exam back, you're able to look through the answers, and you think that either an answer was miskeyed or you misinterpreted the way that the question was written, you will be required to write a formal appeal justifying why you think you deserve an additional mark, and I need to receive that within 24 hours after you have viewed your exam. Beyond the 24-hour mark, the grade is considered finalized if we approach the final exam and you decide to go back and look through your old exams to see if there's any additional marks to put you into a better position entering the final. I'm not going to entertain arguments about exam grades that were finalized several weeks back just before the final exam. So again, when you receive your grade back, it's very important that you review it carefully and see if you think any mistakes have been made, and you do only have that 24 hours in which to do that. Another important point to stress is that grades for all quizzes and exams are entered into the D2L site, which calculates the final raw score and percentage to 1/10 of a decimal place, then assigns a letter grade. This will be considered the final grade for the course and is what will be reported to the School of Graduate Studies. I can appreciate how frustrating it can be to finish a fraction of a percentage shy of a higher letter grade, but this is the policy established by the School of Graduate Studies. Each year, it seems, after the final grades are posted, I receive 3 or 4 emails from students expressing their frustration and disappointment at being just short of the next letter grade, and pleading with me to consider bumping their grade or submitting an extra credit assignment for bonus points on their final grade. My response is always the same. I empathize with the student's position, but the grade distribution stated here and on your syllabus will be honored without bias, and the reported grade will stand and be submitted to the School of Graduate Studies. I'm telling you this now and will remind you of this prior to the final exam. Requests for a higher letter grade, either in person or over email, on the sole basis that the student is very close to the cutoff, will not be successful and are considered conduct unbecoming in the medical, OT, PT, and PA programs. Some general comments on student expectations for this class, many of which can be applied to the majority of classes that you'll be taking through your graduate studies. It's important to remember that you are now entering a professional program, and as pre-professionals, you are expected to conduct yourself in an appropriate manner. If you think about it, following graduation, you will be involved in professional programs where a certain code of conduct is expected. Part of your graduate training is to begin to follow these policies and apply them to your schooling as you would to the professional setting. First of all, students are expected to follow the attendance policies that are set out by the chairs and block directors for their respective programs of study. They're going to vary slightly from one program to another, so it is each student's responsibility to find out on day one what the specific expectations are regarding attendance for their program and make sure that they are in adherence to this. Students need to remember that with the clicker technology, we are able to keep close monitor of their attendance on a daily basis. I'm not in the habit of reporting on a regular basis to each of the department chairs which students are in class most of all, but there have been occasions in the past where department chairs will approach me about certain students that they have questions about and ask what their typical attendance is like. That allows me to go into the records, and if the student has poor performance or poor turnout, I'm able to report this back to the department chairs, which might have a negative impact on the student. Something to be aware of. Secondly, it's expected that students will be punctual for all scheduled sessions. This means that at 1 o'clock there shouldn't be students straggling in, rushing to take their seat and getting out their clicker. This serves as a distraction to your fellow students and is also considered disrespectful towards your instructors. Once again, think about a professional setting. If you were working in a particular ward on the hospital and you had a tendency to arrive for each of your shifts approximately 10 minutes late, that's something that's going to go noticed, and it's going to be reflected on your personal records, and you probably would not expect to maintain that job or receive long-term promotions. Same sort of thing can be applied to the classroom. So if a 1 o'clock session is scheduled, be sure that you are in your seats, have your material out, and your clickers ready by 1 p.m. and be prepared to participate in all activities. Third, students are expected to act in a professional manner at all times. This certainly involves face-to-face interaction with your professors as well as your colleagues within your respective program, as well as within the other programs that you will be interacting with in the anatomy lab and within certain small group sessions. This also extends out to the online world. And a new catchphrase which is commonly being used is this concept of netiquette, which unfortunately does not get as much consideration as it probably should. Some tips for student success in anatomy, which to a certain degree can also be expanded to other classes you'll be taking in your graduate studies. Prior to anatomy class, it's strongly recommended that you prepare yourself for the daily quizzes. For Unit 1, this will involve either watching the video podcasts or reading through the textbook on the related material pertinent to the day, as well as reviewing the appropriate netter plates. For Unit 2, this is going to be reviewing the material that was presented in the didactic sessions from the previous day, as that this will incorporate the content for each quiz the following day. During class, it's recommended that you have your lecture notes open in front of you. It's also strongly recommended that as the professors are going through the material, you personalize your own notes. Add your own bullet points. Add to the existing points that are made. Modify the text so that it makes personal sense to you. Basically, you're taking the notes that are provided and turning them into your own. writing things that are going to help you remember the specific material that was covered during the lecture. This is going to really help you down the line when you're doing the unit tests and the final exam to be able to review the material in your own words and better recall specifically what was being talked about. Also, follow along with the in-class exercises. This could include the didactic PowerPoint presentations, the facilitated active learning exercises that you'll be learning more about as we talk about flipped classrooms, and the case study discussions that will occur. Finally, try and do your best to avoid distractors. I can certainly appreciate that lectures can drag on and make it difficult to allow students to maintain their focus for its entire duration, but this problem is further compounded by the number of different social media websites there are to choose from, and it's very tempting as you're within lecture to tune out for a few minutes here and there and look at various social media websites of your choosing. Short-term reward, long-term consequences. Do your very best to maintain focus within the classroom, leave the social media and other personal web browsing for a later time. Following class, move on to the material that is going to be covered in the following day's quiz. So for Unit 1, this means opening up and viewing the podcast for the following day's material. In Unit 2, reviewing the notes from the day, making sure that you have a clear understanding of the concepts involved. To build on to this point, remember that there are no class sessions on Wednesdays. So Tuesday night would be an ideal time to review the material from both Monday and Tuesday's class. There's a lot of psych studies as far as memory recall and learning goes, which suggest if you review material 48 hours after it's first presented, it's an ideal time to help you to retain the material in long-term memory. So on Tuesday evening, the material from Monday is not so fresh in your mind. It's a really good time to actually take a look at it and make sure that you understand the material from the previous 2 days. Now for the medical school class, Wednesdays are usually involve clinical sessions, and so consequently there's not a lot of preparation that needs to go into it. For the allied health, I do understand that you do have other classes going on and that Wednesdays are often busy, but if you can try to consistently set some time aside on Tuesdays to review this material, it will become habit for you and will make it easier to understand anatomy in the long run. Similarly, good idea to use the weekend to review the previous week's material, starting from Monday and moving all the way into Friday. So if we once again consider Monday's material, you learned it on Monday, you reviewed it on Wednesday, you're reviewing it again on the weekend, you're going to have a very good chance of retaining this into long-term memory. And what a number of people find is when they approach the final exam, they already feel that they're in a comfortable space and don't need to do a lot of relearning of the material at that point. Finally, some general advice to leave off with. First of all, I'd strongly consider designating an evening a week. Ideally for this class, Friday would be good as your free time night. This is a marathon, it's not a sprint, and if you're doing nothing but studying nonstop without allowing yourself any personal or free time, you're going to burn out real quick. Friday night would be a very good time at the end of the week. You don't have anything until the Monday. This would be a time to engage in a favorite hobby or pastime, spend some time with your significant others, family, or loved ones, or getting together with other members of your class and just being social together. It's a chance to really relax, let the material from the week sink in, take a bit of a breather, and then come the weekend, you'll feel refreshed and better able to approach the review from the material from the following week. Second general piece of advice is an old expression, avoid robbing Peter to pay Paul. What this expression means, and it's particularly important for allied health, which have staggered examinations, that it's very tempting when you have an examination in one course to completely ignore another course as you cram and study for the first course. Then once that exam is done, you completely ignore it as you cram and study for the second class. Short-term benefits once again, but long term, you're going to have a better opportunity of retaining the information if you avoid cram sessions, but just try and be consistent with your studies on a week-to-week basis. Similarly, for the medical students, there's going to be a number of Mondays during the block where you will have a morning quiz. It's very tempting to spend all of Sunday cramming for the morning quiz and ignore the pre-readings or the review for the 5-mark anatomy in-class quiz that'll occur in the afternoon. Again, I would strongly recommend that you try and set aside an hour on the Sunday to review the material that is going to be covered on the Monday quiz. This is one of the most difficult things that students find to do. From undergrad, most of you are incredibly well trained to cram as much as possible for individual examinations, and I'm basically telling you to go against that. If you can follow this advice, it might make you feel a bit uncomfortable and unsure of yourself at first. But what you will probably find is, once again, as you approach your final examinations for all of these different classes, you just feel that you're in a much better position and that you've retained all the information in all of the individual classes much more effectively. Next piece of advice is to take an active role in your education. Don't rely exclusively on the advice given by your professors of what to read or what to go find. If you find that you are deficient in a certain area of knowledge, take a look for the resources that will allow you to fill that gap. For example, with anatomy, some of you will be coming in with a very extensive anatomy background. And so some of the material that will be presented will seem redundant to your undergraduate studies and not particularly interesting. If that's the case, consider looking into more clinical application texts to further supplement your knowledge. Finally, don't be afraid to ask for help. I can't stress this enough. You've all been accepted into prestigious pre-professional graduate programs. You didn't get into these programs if you didn't already have exceptional study skills in place. The problem is, as a result of that, it might be sometimes a little bit difficult to admit when you're feeling a little bit over your head and seeking additional help. Everyone wants to be an island and show that they're able to do it alone. You need to get out of this mindset if you are finding that you are struggling and be willing to approach your professors and let them know that you need some assistance. Whether it's for a single clarification question related to a specific problem, or if you find that you are really having a difficult time assimilating the knowledge for a particular unit, it's important that you allow us to recognize that early so that we can help you out. I would strongly recommend that as going through the material prior to the following day's class, you send me emails for any questions or any material that you are uncertain of. I encourage you to come by my office in the mornings prior to class and ask for clarification face-to-face. I encourage you to talk to me after the class sessions prior to us going down to lab to make sure that you understand all the material that's been presented. And finally, I encourage you when in lab to raise your hand on a regular basis if there are structures that you're just not entirely sure of, or again, questions related back to the lecture that you still would like clarification of. If you have a tendency to be more on the introverted side and feel a little self-conscious about raising your hand or approaching the professor, this creates a little bit of a problem. When students don't approach me, I go by the assumption that they are perfectly fine with the material, or if they are struggling, that they found other resources that they prefer to make use of. And my concern there is that if I'm constantly approaching these individuals without raising their hand, that I'm making more of a nuisance of myself and distracting them from their method of learning. So please let me know if you are struggling early on, or don't be afraid to approach me and ask a random question here and there. I'm an anatomy professor. I love anatomy, and nothing makes me happier than to discuss anatomical principles with students. So that includes your gross anatomy orientation for the class that you'll be taking in August. What I've tried to be able to accomplish here is, first of all, give you an orientation to what to expect and save you a little bit of time during orientation week that you won't have to be sitting in class. But secondly, this has been an introduction to a teaching method that I'll be implementing during the first unit, and I've already alluded to. This is the concept of the flipped classroom with video podcast previewings and facilitative active learning exercises to follow. A lot of this will be foreign to you, so the additional link that's provided gives you an overview of the approach that's taken, the perceived benefits of this sort of approach, and what you can expect in the first week of August. Additionally, and importantly, for those of you that do not have an extensive anatomy background or are just a little bit unsure of how they are going to perform in this class, it will provide you with some resources that will be made available to you immediately that will be able to get you dive into the material during your last few weeks of summer. It's not mandatory material, but I strongly encourage that each of you take a look so that you have a better idea of what to expect come August. And let's face it, you're on summer vacation. You can't take it too easy now, can you? So until I see you in August, this has been Dr. Stuart Ingles. Enjoy the rest of your day and the rest of your vacation.